but they're not accounting for the intense pollution in that area. So Mpumalanga does not get extra inhalers. The public health sector doesn't get extra inhalers. There is nothing that says, oh, we need a specialized care for respiratory illnesses. So this has been a crisis for quite a long time, and people have to purchase these inhalers themselves. And inhalers also have a high carbon footprint as well. The emissions from inhalers are quite high. There was a Cedarburg clinic study in the Western Cape, and they saw that their biggest carbon footprint as a clinic is from the inhalers. And the air pollution there is not even bad, and the inhalers are the highest emitters. So imagine if we do some research here where the inhalers would be as well. So environmental groups took government to the High Court over the violation of the constitutional right to clean air. So the deadly air case was launched in 2019. Groundwork and Vukani Environmental Movement took government to court over the violation to give effect and promulgate the necessary regulations for the Highveld Air Quality Management Plan. So the objectives is to put measures in place to improve the poor air quality, and it's home to multiple, like I mentioned, home to multiple polluting entities. So we asked, the demands were that the minister, says that this is a breach of our constitutional right to having clean environment. And also the minister refused to develop implementation regulations in terms of Section 20 of the Air Quality Act. And despite the findings of the Broken Promises report in the Highveld priority area, the department's own negative evaluation of the state of the Highveld, the minister maintains that the tools necessary were adequate. So despite these severe health impacts for over 12 years, nothing was done, and that is why eventually we went to court. And Life After Coal consists of Groundwork, Earth Life Africa, and the Center for Environmental Rights. The Center for Environmental Rights were key in handling this case. So the deadly air case had 3 different strands. It wasn't just litigation. There was research, was a big component of this, and there's many research reports that I can share over the years. There's advocacy, meaning they've been writing letters, presenting to the parliamentary portfolio, and this is like a lot of years of collecting this evidence. So I put this here for us to remind ourselves about Section 24. So Section 24 of the Constitution says that everyone has a right to the environment that is not harmful to their health or well-being, and to have the environment protected, right, for the benefit of present and future generations. Because we're doing the generations after us a disservice by not doing something about it now. We need to prevent pollution and ecological degradation, promote conservation, sustainable development. So health for me, planetary health, I said health is about the body you live in, the home we have, right? The other home we have is the planet. So planetary health and human health are interlinked because we are one ecosystem, and looking after our bodies, looking after the planet, looking after our minds is all interconnected, and it's a one health approach of how we see health. The climate crisis is a health crisis. Not so long ago, we had a pandemic, and not a lot of us could even keep our masks on for a pandemic. Where do you think we're going to keep our masks on for air pollution? So, and the pandemic is linked to the climate crisis. Because of biodiversity loss, I studied viruses. So because of biodiversity loss, viruses still want to live. And if you kill their hosts, they will find another host. And if the host is a human being, tough luck. So this is research presented by Dr. Mike Holland. Dr. Mike Holland has worked for the World Bank, for the European Union. He's independent, he's based in the UK. He did this research in 2017, and he actually did this great infographic on costing it economically. 2.3 US dollars, what is that, like 30 billion rand, but I think that's probably gone up by numbers. But he basically said this is the cases and said these are the amount of death scores. So this is a life or death situation. This is not like, oh, we can just wait for 20 years. People are dying. And this is the infographic that told us how many deaths per year, from which chronic diseases, how many hospital admissions. And hospital admissions are quite costly. quite costly to the public health system. The public health system is not okay. During COVID, we realized how weak the public health system is. And the public health system is not ready for extreme weather events. It's not ready for the climate crisis. And it's not ready to treat patients for, we're already not ready. The climate resilience of the health facilities in Mpumalanga are not ready for extreme air pollution either. So before litigation happened, before these groups took government to court, a lot of things happened. Letters were sent to the Parliamentary Portfolio Committee, like I mentioned. You'll see this dated 2018, writing to Dr. Mutsoaledi about WHO's Air Pollution and Health Conference as Life After Coal. And also there's a documentary called The Bliss of Ignorance. And this documentary basically told you about the lived experiences of people in the Highveld. Because what those infographic was nice about numbers. Beyond the numbers, there are human beings. There are human beings living in these areas, human beings with kids who cannot go to school because they're too sick to go to school, parents that cannot work because they're too sick to work. So, we have a crisis of poverty, of unemployment, of ill health, and this is going for generations and generations. And this was done, beyond the documentary, a lot of research was done by many groups, groups that have been part of this. And in one significant move in the Deadly Air case, the UN Special Rapporteur, David Boyd, who was then the UN Special Rapporteur for Human Rights and the Environment, joined the case as a friend of the court. That Latin name, amicus something. So he joined as friend of the court, and that actually was a significant move in this case. And then the Lawyers for Human Rights also joined, because this was actually a case that had an international spotlight, because it talks about our constitutional rights to clean air. So March 2022, we won the Deadly Air case. The court ruled that the minister has a legal duty in terms of Section 20 of the National Environmental Management Air Quality Act to prescribe regulations necessary to maintain air quality standards, or essentially clean up the deadly air in the region. This celebration was actually in Paula. We were in Paula. I think Ronald and Vem are here as well. They can also tell you more about the case. I was there for the celebration in Paula, and this is the time that I just started working for groundwork. You can feel the air you breathe and the environment change when you're there. Like, you know that feeling where your lungs feel itchy? I don't know if you've experienced that. But that's what it feels like when you're there. And people live there all the time. They can't escape it. You can't open your window and say, hey, I'm going to get fresh air. There is no fresh air in this area. So this was a landmark case, huge victory, and we're still following up with it. This is March 2022. I think this battery is a bit low, but okay, there we go. So the case continues. This deadly air case was heard in 2024 in the Supreme Court of Appeal in Bloemfontein. And this year in April, the Supreme Court of Appeal handed down the judgment dismissing the minister's appeal of the landmark court judgment. And the current minister actually published the necessary regulations 2 days before the hearing. However, the appeal still was adjudicated for the sake of justice and for the sake of future considerations, but also knowing that we are not enemies with the DFFE. We actually work together with the DFFE. We work together with the National Department of Health. Civil society, like I said, the litigation was the last resort. But this is important for us to note that the minister still granted Eskom power stations exemption from the compliance with the minimum emission standards. And this is just a violation to weakening of laws. So I'm going to speak a bit about just transition and health, because this is actually what my work is about. We work with hospitals on this, and we're looking at the just transition. We're calling for a just transition away from coal to look at renewable energy, clean energies, from pollution protection. Just transition used to be about pollution protection, but now it's about everything else. A just transition, we can't just have carbon tunnel vision. It's not just about the carbon, it's about every other aspect. So beyond occupational health and safety, beyond environmental justice and labor, we're looking at things like gender. Decent work and green jobs are included, yes. But what about the social aspects of this, of the just transition? So I spoke about how I'm going to highlight health. The Just Transition Open Agenda is free for everyone to comment on. So if you'd like to contribute to this open agenda for the Just Transition, please do. We're talking about a new energy system. We're talking about not financing coal, decommissioning, but we're also looking at health, because health is so important and health has been affected. And remember, there's no borders in the air. There's no borders. There's nothing to protect you. So if the air is dirty, it affects every single one of us. Looking at things like transport, communications, food sovereignty. Food insecurity is a problem in this country, and it's not necessarily highlighted, but a lot of kids are suffering from malnutrition. Another one that I'd like to highlight is gender justice, because gender justice is very important for us in the climate justice space. There's no climate justice without gender justice. And South Africa has made a lot of strides in terms of gender as well. And also an open democracy is important. I just forgot to highlight that, and protecting our open democracy. And that is why we have a great constitution, and we could work with government because of an open democracy. So there's this health planning document. We are working, this is not the only document, there's a lot of health planning for restorative justice in the Highveld. So we do health research and surveillance in communities as well as healthcare systems. There's interventions to restore and maintain the well-being of communities. And I want to talk about that healthcare post-to-population ratio. Remember the 1,000 doctors? Now this is just a healthcare worker, one healthcare worker, so it can be a nurse, community healthcare worker, to 23,000 people. It's not feasible. That's why the waiting lists are so long. I spoke about the medication shortages, limited ambulances. After our emergency services in lots of areas, they don't exist. So what happens if you can't access healthcare? And 86% of our population in South Africa are uninsured. And it's important to do primary health care, because I always tell people the best way to reduce your carbon footprint is to have less people going to hospitals. So if the clinics and the primary health care services are strong, you don't get people in a hospital bed. And it's important to look at NCDs are your non-communicable diseases. And we also look at the Batupili principles. Government works with Batupili principles, but it's also important when we're looking at restorative justice about the Batupili principles, people first. And that's what makes us different as South Africa, right? In the spirit of Ubuntu, in the spirit of putting people first. And that is why we talk about stakeholders and having your communities that are actually participating in these processes. And health is important in our just transition. These are the other publications that we've done as Life After Coal, with UKZN mostly, University of Pretoria also involved. It's about the coal's health impacts in Paula. And this has been like widely researched. It's probably been researched, people in universities in London are researching Mpumalanga. Waverley Street Foundation, very interested in Mpumalanga. I mean, Clean Air Fund has also been working with us in the Highveld with the Health Literacy Days. My colleague Mafoko Pomani hosts Health Literacy Days in Mpumalanga, so that people can understand the effects of health and understand how to manage these health effects and understand where to access clinics and how to access clinics and what medicines they will need as well. Because this is actually the importance about how air pollution contributes to the climate crisis, but it also impacts our health. So it's quite a far-reaching thing if you think about it, because we have the Paris Agreement, we have our climate change bill. South Africa is the highest emitter on this continent. Like, the other countries are emitting so much less than we are. But, there's always the thing of, yes, we also do have load shedding. But we need to look at this holistically from a systematic systems point of view, and not just look at things like having access to electricity. Because I told someone, I don't want to switch on my light bulb, and every time I switch on my light bulb, I want to think about the 5-year-old with asthma that's going to probably die because they don't have access to a health facility. I mean, the fact that the power stations are all concentrated there, I mean, this is, our democracy inherited that. That was probably planning because they didn't want the thing, because of the proximity to the mines. But it's unfair that this hotspot has become a sacrifice zone. It's basically a sacrifice zone, and we're sacrificing people at the altar of what we call development. And development is another thing we could talk about. So restorative justice for mining communities is a reconciliation between communities and mining entities, facilitated by stakeholders to acknowledge and compensate for the harms caused. And they have to honor their rights to an environment that is healthy, because we all deserve to be in a healthy environment. Yesterday someone mentioned about Pretoria, that it doesn't matter where you live. You don't have to be in a vulnerable community. You don't have to live in an informal settlement. I live in Pretoria. Every single day there's a little widget from the weather services. Every day the air quality says unhealthy, right? So because it's so unhealthy, my sister has been very worried about my health. So for my birthday, she bought me an air purifier. I don't know what dystopia we live in where you get an air purifier for your birthday, but I mean, I was very grateful. But just thinking about something that is as basic, and not everyone can afford an air purifier. That's just it. I mean, are we living in that type of world where this is the type of norm, that air purifiers are so important that we can't negate that? So we must also remember that there are no clinics in close proximity to a lot of these spaces, and the clinics do not have specialized care for respiratory disorders. So people become seriously ill, they actually are exposed, and also for pregnant women. Despite the evidence of the adverse effects, there's no maternal care specifically for this. And we know about pregnancy and how vulnerable pregnant people are during pregnancy. So what I think we should look at from my health lens, you can also give me a perspective from your lens. We look at low carbon, climate resilient public healthcare infrastructure that is anchored by communities and accessible to all. So I think it would be fair that, yes, the clinics in other provinces probably don't need 24-hour services, but maybe Mpumalanga does. Mpumalanga is a special case, and we saw yesterday that number of healthy air days, and the fact that Gauteng is less than Mpumalanga is actually quite scary, Dr. Patience, because it means that it's showing that the priority areas are actually starting to link up, and we're going to have this big, when you look at the IQA, this big red patch. And we need to repair historical injuries as well. It's not fair that some people could be sacrificed for the sake of just having certain industries thrive, right? And we're looking at restorative justice to compensate affected communities. And compensation is not always money. Compensation is opening a clinic, making sure there's roads. Water is directly linked to air pollution, because air pollution doesn't just stay in the air. We have a water crisis in South Africa. We do not have access to clean water. There's currently water restrictions in Tshwane. We know how scary day zero was for Western Cape. I actually have, in a different presentation yesterday, I had pictures of, in 2018, Beaufort West, the Gamka Dam was all cracked up, and in that same year, Knysna was flooding. So we are also subject to extreme weather events. And in extreme weather events, who's the first responder? Healthcare facilities. The problem, what happens is, in KZN is, the healthcare facility, the road was completely washed away to the clinic. The people at the clinic had to be rescued. And that clinic is closed. People could not access their medication. We're working on actual research on extreme weather events on a crisis app. During a crisis, how do people access their ARVs, for example? How do people access basic baby formula? And we're going to see more extreme weather events, and obviously some places are not as affected as others, and also affected in a different way and in a different manner. So by what we talk about redress and infrastructure development, we talk about the determinants of health. Now the determinants of health is the air you breathe, the water you drink, the food you eat, the people in your family, they also determine your health. Those are lots of things that, and we also have political determinants of health as well. We call for universal health coverage. Medical aid is extremely expensive. Those of you in here who have medical aid, I think we know that the prices have catapulted. They have not gone up with inflation. They're very expensive. And we need far greater transparency about regulation, monitoring, and compliance in the high felt priority area, because building trust requires transparency. And if we trust that your life is in good hands, we need to make sure that we have transparent data. I always say scientist to scientist. Science should be for social justice. Because you know the saying, knowledge is power. Knowledge is not just power on its own. Knowledge is power when it's effectively implemented and it makes a difference in the world. So we need to adhere to our air regulations and strict emission control to reduce exposures and the risk of coal-regulated pollutants. Because, like I mentioned, it's a matter of life and death. People are dying, and we have to do something about it. And that is why the sense of urgency comes. And for years, we haven't done something about it. We've failed. So we need to limit harm to our environment. We have to restore and renew our ecosystems and our natural resources, because the home of the Big Five deserves to live. The Big Five deserve to live before the air pollution gets to them as well, but also the people of South Africa. And I'm going to close by just saying I hope that Mpumalanga goes back to its glory of being the land of the rising sun. Thank you. Oh, we're doing questions.
Thank you, Aziza. Wow, that was wonderful. The place of the rising sun. I think we should change that name in our indigenous language, Mpumalanga. I will open the floor for any questions.
Morning, good morning, ladies and gentlemen. Caesar, thanks for a very enlightening presentation. I am Oliver Fu from the Northwest University. The question which I have for you is, given the current trajectory, when do you think that government will be able to clean up the air pollution in the high-vert priority area? And if it's going to take very long, do you think that you should approach the court for maybe a structural interdict to be able to force government to move a bit faster? And what is the prospect of actually using this remedy, given the fact that we know government has not complied with many other court orders before? Or are we just in a situation where we don't actually have a solution?
Thank you, Aziza, for such a great talk. My name is Patum Kwebo from Northwest University also. So the judge made a conclusion that Section 24 is a right that needs to be realized immediately, correct? And Professor Michael Kidd from the University of KwaZulu-Natal who is an environmental lawyer, wrote his opinion piece on that, saying that seeing that the context of South Africa and the challenges that it faces, it seems like the judge read that section, the two subsections, as if they are independent to one another. And looking at the South Africa's context and realities, is it really realistic and fair to think that looking at the challenges in terms of energy and economic challenges, is it realistic really to realize that right immediately? Thank you.
Okay, I'll respond to the first one about the funding. So the Presidential Climate Commission consists of also people from civil society, including the Director of Groundwork, Bobby Peak. So the Presidential Climate Commission works with the presidency, to look at the various parts of the Just Transition investment plan and the Just Transition specifically. So there's a lot of money being put into Just Transition, but there's also been a lot of, Eskom has been investing in renewable energy, a lot of renewable energy. So I'm actually going to kind of include yours in that as well. The fact that the Just Transition Partnership, I can't remember the billions, but it's a lot of money. invested for Just Transition Investment Plan in South Africa. And South Africa is actually being looked at as a case study for other global South countries. I think in terms of what we can see from mobilizing from that just transition point of view, Mpumalanga needs to be a priority for the just transition, for any just transition partnership, especially because of that concentration of the historical coal-fired power stations that were built there during apartheid. And then in terms of being realistic, I think we need to look at our timing. We need to accelerate this as an emergency because there's a climate emergency, but there's also an emergency of people dying from air pollution. And if we mobilize, we could mobilize during COVID as an emergency. We had quarantine sites, we mobilized, right? And we don't talk about that elephant in the room of corruption because during COVID there was a lot of corruption. If we take away corruption, we have enough money. We have enough money and we can do this. We are more than capable as South Africa to lead a just transition because our first just transition is when we became a democracy. So I think we are quite equipped and maybe we do have a bit of imposter syndrome as South Africa. Timing, yes, there might be a slight delay that we can maybe in researchers can tell us, you know, what is realistic and if we close down this one, how many megawatts do we need of renewable energy? And also, but a lot of people have moved to renewable energy. NACA hospitals have renewable energy on their rooftops, and this was all done because of load shedding. So load shedding was an opportunity and a crisis, and wherever there's a crisis, there's an opportunity. So I hope that answers your question about how we work in a crisis.
Okay, good morning. My name is Lesahonolo Morawani. I hear you talking about the just transition. And I don't know if you are aware of the Komati case in terms of Eskom. I feel like just transition is a swear word when we consider what the community of Komati have gone through. As much as South Africa is a case study, let's learn that you cannot remove 1,000, 2,000 megawatts from a grid and think 100 megawatt solar plant is gonna solve or compensate for those 2,000 megawatts. The sun doesn't shine every day and it's not windy every day as well. And you can only store so much energy in terms of battery storage. So it's like we are in this weird balancing act between air quality and the economy. And the truth is, us transitioning away from certain types of fuels has a very negative impact on the economy. So as much as, yes, in terms of air quality, we want to see improvement, I think it's better to look at alternatives in terms of improving instead of removing certain structures. Yes, we need to improve sustainability, tomorrows and everything, but let's look at the mitigation hierarchy and engineer controls instead of just eliminating the causes of issues. And I know it's a bit interesting from the organization I come from to have this conversation, but I think we need to also look at the economic impact of the transition. I just won't call it just, because I don't believe that it is where we are currently. We cannot, as a developing country, be the case study for such a transition. This is my opinion, because our economy really can't afford it if we're losing jobs at the rate that we are. A power station normally has jobs for about 1,000 people internally. Then with contractors involved is about up to 5,000. When you remove that power station and you put whatever else, it maybe caters for 100. So there's a lot of things that are involved in this transition that needs to be considered, and not only from an equalities perspective, but from an economical perspective as well. Thanks. Thank you, Lesahonolo. There's another question.
Hi. I'm Natasha Shackleton from Atmospheric Consulting. So mine's also on the just transition thing. So you mentioned that Mpumalanga needs to be involved in that. I know someone who works in Mpumalanga that is part of the department, and he was saying there's been lots of solar and wind facilities coming up, and it's actually being very damaging to biodiversity. So in that context, how is the just transition in Mpumalanga supposed to take place? Like the way you were saying, Mpumalanga should be involved. How should they be involved?
Well, that was our last question because of time. Please, you can answer the two.
So I think, Nolo, you had more of a comment, right, than a question. And that's an important comment I think we're looking at, because people do say, what about our jobs, right? What about jobs? People who are sick can't work, though. When you have a sick, like that economic cost that Mike Holland, we're actually costing more, the health and the death impacts. And yes, people lost jobs, but people also lost lives. Deaths are involved. So I think the balance between looking at what we could feasibly do and how we could reskill people. I think there's, I forgot the person's name, but University of Stellenbosch is also working on looking at decent jobs. How can people have decent jobs that is not damaging their lungs, and then at the age of 40, they can't work anymore. So they work between the age of 20 to 40, and then at 40, your lungs are done, you're done, you can't work, you're unemployed, and that's it. And I think that is not a meaningful way of developing as a country. So that's the type of aspects we have to look at. Regarding the solar energy in Mpumalanga causing issues to biodiversity, please do share the study. We like to look at evidence, we like to look at facts, we like to look at the science, because that should not be happening. I know the Western Cape had those wind turbines, but now there's bird-friendly wind turbines that are friendly towards the birds. And there are also issues about renewables done right. So as Friends of the Earth International, we talk about renewables done right, because there's also a lot of extraction in Congo. And the part of looking at the just transition and why stakeholders, so Presidential Climate Commission has done these stakeholder, and sometimes they do these stakeholder meetings as a tick box exercise. But we need it to be more meaningful, so that is where we need the evidence for the research, but also people's lived experience to be shared, so the people can share that this is what happened, because we're working on territory that we've never worked on. We're working right now with technology we haven't worked with before. So what has been done in the past there's no blueprint for this. So we're figuring this out with best practice, looking at a community of practice as well. So it's very important to get those voices out there and get that evidence out there. And thank you very much for sharing.
Well, thank you, Aziza. Abel, we can take that offline because of time. We have to hand over to the next session. Or
we can extend by 5 more minutes. It's fine.
do we have online questions?
So we have one question from Rudolf Berger from Northwest University online. He's asking, but Eskom is not the biggest contributor to ambient air pollution. What can be done about the other sources, specifically in Mpumalanga?
Okay, that's interesting, because the evidence suggests that Eskom is the biggest culprit, factually, not opinion-wise, for Dr. Berger. But the others have to be, like the mining, we also have been looking at the mining. There's one oil refinery. Corporate social responsibility is what we're also looking at, where polluters have to pay. The polluter pay principle extends beyond just Eskom. And like I said, even the anesthetic gases that you use in a hospital, the inhalers also have a carbon footprint, not as high. But when we look at statistically, they are the big polluters, but it's about getting it at the source. And if the source is a different source that is not our public utility, I don't usually call Eskom by name sometimes, because no one knows Eskom outside of South Africa. Our public utility is not the only culprit in the general sense of things, but there are others, and there's lots of factories that need to look at their emission standards, and they shouldn't we shouldn't be extending their their licensing to go over the minimum emission standards as well.
Do we have more questions? We'll take Dr. Gwaza and Abel.
Thank you very much for the talk. I was listening attentively, but I also wanted you to have taken your talk further to the end, because once the judgment came out, a lot of work has also been done. And for the audience in this room, I think it is important for them to understand how far the judgment went and how far the department has gone to abide with the court judgment in the case of democracy. And it's important for us to, maybe we can do that in another talk where we actually extend the obligations that the government is putting in place to align with the judgment. And the second part around the issues of ESCOM and the exemption. I know we are now in a different territory, but I think for the sake of the audience, because you raised it, let me just highlight some of the few things that informed the minister's decision so that it was put into context and aligned with the court judgment, at least in the current perspective. There are 4 key areas that he provided in terms of ESCOM's judgment to say the health and social responsibilities must be met. So issues that people are calling offsets are not necessarily offsets in a sense of it's substituting stack emissions. It's environment, social justice, and I think social interventions is the term that minister used. And I think that's why yesterday's discussion, I said, let me excuse myself because the understanding that we have might be different. And also the other elements around transparency and information sharing, I think we can talk about that in future so that the context of the exemption decision is maybe made clearer, and maybe we can share the actual decision so that people realize how far the minister went to balance economic development, social justice, and allowing the utility to operate in the environment that is in. And I'm not defending, I'm just putting what the minister put on facts so that it goes to the audience. Thank you very much.
Thank you, Dr. Gwaze. Abel?
Hi, thanks for the talk. My comment or a question is, and it's something that I would like to see, that there's an estimation that comes with numbers to say 9,000 people were killed by air pollution exposure. But I would like to see at some point a study being taken further where an individual is going to be tracked, maybe by doctors, HPCSA, and that person must, if he is healthy when he starts to stay in polar, and there's going to be a file and it's going to be tracked by epidemiologists or health practitioners, those who are qualified in that respect. And indeed, it can be proven that the deterioration is coming from the exposure, so that we can have these numbers that is quantified rather than only estimation that 10,000 people or 9,000 people from a certain methodology. We're not saying the methodology might be wrong or something. I'm not questioning the methodology, but I'm just saying I'll be interested in future to have that kind of research that is being done by independent doctors, whether it's HPSA, and that being funded by whether it's industry or not, that they're going to track the level of people, those who are exposed to air pollutions, and they can give us those numbers. Yeah, that's all from my side.
Thank you, Abel.
No, thank you, Dr. Patience, for that context. To answer your question about the research, the MRC, the Medical Research Council, Dr. Carady Wright and her team have actually published, was it the beginning of this year, they have published evidence of that, the exposure linked, mortality and morbidity linked to the exposure. So the MRC actually has quite a few publications on that is not just estimates. And beyond the estimates, we actually think it's higher. The real numbers are probably higher than what the estimates say. So the estimates are not an exaggeration, they're actually an under-exaggeration if you look at the clear health evidence and the health research that is out there. So not just the Medical Research Council done that, but also UJ and Wits University have also done the research on the air pollution and the exposure linked. But in terms of health workers, that is a very interesting one because we find that a lot of doctors, when they do their ComServe, they don't want to stay in the Highveld. Everyone wants to be in the city, they want to be in Cape Town, they want to be in Johannesburg. They don't want to stay in the Highveld. So it will be interesting to track a doctor that lives there that didn't live there before and goes to the Mpumalanga, and that would be an interesting one-person study. But in general, with the patients, and the district health barometer has a lot of interesting cases on the respiratory diseases. So the district health barometer, they post the South African Health Review, is published, South African Health Review, and they are an independent. We don't really we work with them in the Public Health Association of South Africa. We have a special interest group on climate, energy, and health, and the focus is, in the public health fraternity on that exposure specifically. But happy to share that when I'll find Carady's article specifically and share that with you.
Thank you, Aziza. It looks like you're going to be having a busy mid-lunch and lunch talks. Brings us to the end of the session. Just a token of appreciation, Ms. Aziza, please come to just welcome and receive the appreciation token from our Vice President. I'll be introducing the next session 7. That will be chaired by Mr. Sibusiso Sinuka,